Good morning, everyone. Andrew Douglas here in the Action News 5 digital desk. You know, it has been something that we're seeing not only across Memphis and the Mid-South, but across the country, a record number of children with respiratory viruses like RSV, influenza, COVID. It's leading to longer emergency room wait times, reduced capacity ahead of what's predicted to be a severe flu season. And in some areas, the surge has meant local hospitals don't have enough space for all the children that need care. So let's bring in our pediatric medical expert, Dr. Joanna Parga-Belinkie, joining us now to really kind of talk about this issue. What is causing the surge in hospitalizations, doctor?
Well, it's so nice to join you today, and thank you for bringing up this important topic. So what's causing this surge? You know, I think that part of it is that we have this unpredictability to viral season, which is due to the pandemic, right? So viruses that used to peak sort of in the late fall, early winter, like RSV, are now peaking earlier. And kids are getting sicker because they haven't been infected with these viruses before. In addition to that, we also have a mental health crisis in this country. So a lot of beds are being taken up by youths who have mental health issues. So you've got kids who are sick with viruses, you've got kids with mental health issues taking up hospital beds. And then you mentioned this as well, we have reduced bed capacity. There are just less pediatric beds. And this was a trend that started to happen even before COVID. So we really need to think about opening up more pediatric beds. That and your pediatric healthcare professionals are getting burnt out from years of COVID and now this viral surge. And so there are just less pediatric healthcare professionals to take care of these children as well.
That's rough. And then, you know, a lot of people are questioning, why are more children getting ill? Is there something that we're missing with all this? And is there varying opinions?
Yeah, I mean, there's not an exact answer to that, right? And you're going to get different opinions everywhere. But I had mentioned this, you know, the COVID-19 pandemic, and COVID is still with us, making kids sick. But during that time, you know, people were more thoughtful about physical distancing, about masking, about infection control measures. And those have kind of more gone to the wayside. And if you think about it, our younger children who tend to get sicker from these viruses, our less than 5-year-olds, again, haven't been exposed to them, right? So we think that might be another reason why we're seeing kids just get sicker from these viruses.
Very interesting. All right, so let's talk about some of the steps that parents and caregivers can take here to prevent illness. No, you know, no one wants to get sick, and when we get sick, we have to follow certain guidelines. Let's prevent it first, right?
Yeah, I love this question because I think there are things that we can do to help prevent the spread of infection, right? So the first and foremost is try to get vaccinated. This goes for adults and this goes for children. The COVID vaccine you can get for children greater than 6 months of age. There's also a COVID booster that was approved for children greater than age 5. So getting vaccinated for COVID, also getting vaccinated for the flu. And we are seeing a flu surge now, but it is never too late to get that flu vaccine. And vaccines not only help prevent the spread of disease, but they can actually make diseases less severe. So you can get less sick when you are vaccinated. And then the other things to think about are infection control prevention measures. So if your kid is sick, try as best you can to keep them home. You know, if you're going out in public and you're coughing, cover your mouth, but don't do it with your hand. Do it with the crick of your elbow and be washing your hands a lot. These simple things will also help prevent the spread of infection.
We have a lot of young parents here in our newsroom, doctor, and it seems like at one point or another, everyone's gotten sick. Their little ones have gotten sick. At what point do you say, okay, this is really severe, we need urgent medical care?
That's a great question. And that's always on my mind, too, because I have young children. I have a 3- and a 4-year-old. And so the things I think about is, you know, are they having a lot of trouble breathing? That's probably the biggest thing. And what do I mean by that? I mean, are they using extra muscles to breathe? So can you actually see them using the muscles in between their ribs or the muscles by their neck to help them breathe? Any baby who, or a child, young child who is in respiratory distress should go to a hospital. And if they can speak to you and they can't speak to you in full sentences, that might be another sign that you need to go to the hospital. But if you're ever in doubt, or have questions, I really encourage people to call their pediatricians. Usually there is a 24/7 line for pediatric offices, and they can help you make that decision about what to do with your child and whether it's time for hospitalization.
Okay, let's talk about where people can go for more information about all these kind of tips and tricks that we can use heading into flu season.
You know, I really love resources from the American Academy of Pediatrics. So they have a website. It is called healthychildren.org. I think that is just a great place to go. And the Centers for Disease Control and Prevention, or the CDC, also has great information about this viral surge.
Okay, Dr. Joanna Parga-Belinkie, we appreciate your time this morning. Thanks very much for all the insight, and have a great Thanksgiving.
You too, and I thank you so much for covering this really important topic.